Welcome, everyone. Today we are having another installment of our Ask the Expert series here at the Penn State Center for Healthcare Policy and Research. And I'm pleased today to have as our guest Kate Farley. Kate is the Executive Director of the Pennsylvania Employees Benefit Trust Fund. And PEBTF, as it's known, or as I know it, provides healthcare benefits, insurance and healthcare benefits to both public employees and their beneficiaries in the Commonwealth of Pennsylvania, as well as retirees. And in total, there's more than about 138,000 beneficiaries with an annual spend of somewhere between $1 and $2 billion. So PEBTF spends a lot of money, covers a lot of people, and is very active in providing health insurance and health benefits for many, many Pennsylvanians across the Commonwealth. So Kate, welcome, and thanks for being here with us. The reason I wanted to sort of interview you and have you on the show, I guess, is because I think you're a great example of a purchaser, as we would call it, someone who takes dollars and provides healthcare benefits for many beneficiaries who need healthcare services through insurance programs and packages and otherwise. And as such, I know the work that you do. You view this from a value-based purchasing perspective. Sort of making sure that you're getting value as much as possible from, the more than $1 billion that you spend on an annual basis. So I was wondering if you might add anything else for our listeners about PEBTF, just in terms of, how you approach your job from a value-based purchasing perspective. Anything else that might be important sort of from a historical or contextual background so that folks know, sort of the work that you do.
Well, first, thank you for having me, Dennis. I would like to add that PEBTF is somewhat unique in that we are a joint labor management fund who is responsible for administering the benefits for, we talk about members, not beneficiaries, so I'm just going to clarify that. There are about 175,000 active members, and there's over 100,000 retiree members that we manage their medical benefits. And what we are always interested in doing is making sure that we can get the best value for those members so that the benefit package that is afforded to the active and retiree Commonwealth employees can be maintained at the really high level that it is today.
This concept that we hear a lot about, value-based purchasing, we certainly have heard that from large employers who are self-insured. We've heard that some of the more proactive and aggressive state Medicaid programs, for example, across the country. And more recently, we've heard this from CMS, where they've actually set targets about the percentage of overall Medicare dollars that would be tied to a so-called value-based reimbursement. I'm wondering generally, and I do want to get into some of the specific programs, like the bundled payment program pilot that you've done, but maybe you can help our listeners sort of understand the concept of value-based purchasing and some of the broad categories of tools and things that you do as you approach this getting value for the money that you spend.
Value-based purchasing actually is one of those kind of very, I kind of think, nebulous types of terms. It certainly is looking at making sure that the quality of care that is received is good, that members have access to care, and that it's done at the best price. Historically, value-based purchasing has meant a lot of different things to different carriers. We deal with different carriers in this state. And we are a self-funded client due to our size. And so we're paying actual claim costs plus an administrative, expense fee per member per month. And when we look at value, it's not really just the lowest fee that you can pay for something. It's really looking at, do members have access? Are they bouncing back into the hospital all the time, bouncing into the emergency room, making sure that patients with chronic conditions, and because we have an aging population, we have many of those diseases in our population that are managed primarily with medications. diabetes, hypertension, things like that. And so we want to make sure that they're also taking their medications. We don't want to see people not taking their medications. So you have to balance all of those things. And then ultimately, you want members to be satisfied with the care that they received.
When you do this kind of work, and I know from some of my own involvement here at the university, there are many people that knock on your door and say they can help. Vendors with different services, different products, different data analytics. And of course, this is multiplied significantly over the past couple of years. I'm wondering, as you go about doing what you said you do, how do you make decisions on sort of what tools, what vendors, what products and services might help you do your job versus others that maybe, are something you could spend your money on but won't really help you with your ultimate goals?
Part of anything that we look at is an evaluation of what the ROI will be on the tool. And sometimes there is no hard ROI, but the benefit in terms of either disseminating information to your membership or helping them manage their medical condition better, it's not a hard dollar. But many of the other services that you're talking about, we go through a pretty exhaustive analysis of what that service is. And everybody will tell you that they're going to save you money. And you really have to pull that apart to identify where those savings are going to come from. Because everybody's loves to throw in a big chunk of what they call avoidance savings. So if you use this product, X, Y, and Z won't occur, and we're going to save you all these dollars. And that's not really real necessarily, so you have to be very critical. And I came from the health plan side of the world, so I sort of understand how to kick the tires on a lot of that stuff, and that's been very helpful in analyzing things. But I always say to people, if you've seen one, you've seen one. You really need to ask a lot of probing questions.